Saleyha Ahsan, who has essentially filmed her own journey through the second wave of the COVID virus. Let's begin with the why of it, if we may, Saleyha. Why did you want to do this? Why did you do this? And then the what of it. How bad has it been?
So the why. I'm a strange beast. I have a career where my first career was journalism. So
and then you decided to do something useful.
So I actually went and started medicine, but I continued to freelance. So I've actually been telling stories and making films for about 14 years now. And normally my films would be somewhere over there. I'd go off. I've done films in conflict zones and humanitarian settings. So normally I'd be a doctor in the UK and do all my filmmaking somewhere else in really challenging circumstances. In the last couple of years, my filmmaking has been firmly within the UK because the scenario within the NHS, even pre-COVID, became really challenging. And I work as an A&E doctor. And we all know that A&E over the last few years have had its own challenges. This year, well, the last 12 months, since COVID arrived in the UK, the camera had to stay firmly here in the UK because I didn't have to get on a plane to see a crisis. It was happening right in front of me. It was when I was going to work. All my siblings are healthcare workers as well. They're all doctors. And it felt like I was on deployment, from the preparing at home to make sure everyone was safe to actually going to work. But this time, there was no aeroplane to board to come back home to safety because it was here. And
that's weird, isn't it? That duality is, I can tell by the way that you're speaking and describing it, is that was jarring because it's almost as if you turn on the journalistic gene when you're out on assignment and then you turn it off when you're back on the wards. But here, they're both on full volume all the time.
It clashed. There was no escape. And I'll tell you the telling moment. It was about April last year. And I got a phone call from colleagues who I'd filmed with in Tripoli during their war. And I'd filmed with them and I'd followed them and I'd made a documentary about them. They were calling me in April from Tripoli to ask if me and my family and my colleagues here in the UK were okay. That was the moment I thought, oh, good grief, this is real.
Why do you think the impact here was so much worse than in comparable countries, other countries? I mean, and indeed incomparable countries like Libya. But what was it about the UK that left us so exposed to this and has therefore seen such astonishing death rates?
I tell you what was really stressful from a position of a healthcare worker working. You continue to go to work. You continue to have the briefings that are filtered down to our level. From senior level, they'll be all having their meetings and it's filtering down to us. I think what was really stressful, we were trying to prepare, but we were seeing, and I'm speaking personally now, I'm speaking both as, I'm not speaking on behalf of my hospital, I'm speaking just as a jobbing doctor, but also as someone who works within journalism as well. I was following the news and I was waiting for that precise action that was going to protect us and keep us safe. And then there was the stalling. Then we all saw the footage of Cheltenham races. I remember that morning thinking, what on earth? What on earth? And lo and behold, a couple of weeks after that, we were into our peak of the first wave. I mean, you can draw it in a diagram. You can chart what we were seeing in terms of events and the stalling of action to the peaks and troughs of the numbers and the figures within the NHS and the awful mortality figures and the numbers of people arriving in intensive care. And and then we saw it again before Christmas. I started filming. I pitched my film I would love to have been more, have more faith in the system that it was going to get it right. But I kind of didn't. And I pitched my film about the coming storm back in August, September.
Gosh.
Because I said, COVID will be coming. It will probably be bad because I expect we're not going to have learned our lesson. When I say our, it's, collective our. I will add the caveat that I'm in Wales and we have Welsh government and obviously Westminster is the rest of the UK. But things have happened differently in Wales and I was thankful for that. But it didn't take away my concern and my worry about what was going on in London, where the rest of my family were. I was grateful for the fact that I was in Wales.
I'm short of time, so I know that the personal perspective extends to the universal experience of healthcare workers. Some of the statistics that have popped up in a survey conducted in conjunction with your programme are staggering. 76% of all NHS workers saying they'd experienced negative reactions or abuse from the public, a figure that increases to 86% with black, Asian and ethnic minority nurses, 82% saying their personal life had been impacted, 79% saying that the pandemic has had a negative effect on their mental health. It all makes, much as we enjoyed the Thursday night clapping, it all rings a little hollow now, reading these numbers.
Absolutely. I mean, to be honest, the clapping, the clapping the first couple of times was great. It was, feel recognised. But then it kind of didn't follow through with actions of the public. If you maybe even asked someone to maybe not stand within 2 meters of you, you'd get verbal abuse. The actions on the balconies and on the doorsteps of Thursday night didn't sort of translate over to what was going on during the day in some circumstances. However, lots of people have,
of course.
So credit for them, absolutely. But from a higher perspective, it's decent pay. It's making sure that recruitment's on top so that, the gold standard of one-to-one nursing and intensive care can still continue. It's so that, staff manning the COVID wards are not doing extra shifts, up and down the country because they're short.
And
that's the real help.
And then that is notable still chiefly by its absence. Condition critical, one doctor's story.